everybody. So today we're going to talk about pregnancy back pain. So back pain that's mostly related to pregnancy. Now, just getting pregnant alone, it's hard enough. You have to deal with the extra weight, you have to deal with all the changes that your body is going through. You do not need to still deal with back pain. So hopefully through this video you will have a better understanding if you are suffering from back pain because of pregnancy. Then I hope that you'll find this video helpful. So the particular back pain that we're talking about today is what we call the Sij pain. Now, it's particularly common for pregnant female. Most of the time at the end of second trimester, going through to third trimester, or just at third trimester. It will happen, but very rarely will female have this sort of problem on the first trimester. Yeah, and also it can happen. I'm not saying that it can't happen, but it can happen to female who is not even pregnant as well. So let me just quickly explain it. What's Sij? Yeah. So Sij joint is actually the part of the joint. So this is your spine. That's the front. That's the back of your spine. Sij is the joint. It's called sacroiliac joint, which is the joint that runs right here where it ends, where your tailbone is, joining to your pelvis. These two joints here is what we call the Sij joint. So what you're looking at right now is the Sij joint, as you can see here, this two joint there. Now they are mainly stabilized by ligaments. So all these white stuff here is all ligaments, and they're very strong and they tend to be good enough to keep the joint stable. So during pregnancy, what happens is your body starts to change and prepare yourself for labor. So what happens is all these ligaments will start getting looser and looser to prepare yourself for labor. Yeah, and when that happens, what will start having a lot of instability going on around this joint, and it starts to hurt. So the most common symptoms where people with Sij will experience is when they're walking, it hurts. When they lift up one of their legs, it hurts. Going up and down the stairs hurts. Turning in bed hurts. Getting in and out of car hurts. So those are the most common symptoms that we tend to hear with female experiencing from Sij pain. Now, what happens is when your ligament starts to get looser, to compensate for the looseness, you would have to start activating your muscles to stabilize that joint instead. And women who doesn't have that ability, like if they have a bit of weakness in their muscles, that's when they will start experiencing Sij pain, because nothing is really stabilizing that joint at the moment if you don't fire on your muscles enough. Yeah, a lot of people talk about pelvic strengthening, core strengthening when you're pregnant, which is good, but what they fail to say is the posterior sling muscle, which is specifically important for pregnancy and very important to stabilize that Sij joint. So if you look at this picture, this is our posterior sling muscle. It's basically your back muscles joining to your bottom muscles. How they work is when these four muscles turn on together, they have a crisscross effect, and they stabilized the middle structure here, which is your Sij joint. So pelvic floor is important, but if you do have Sij issue, not only do you need to train your pelvic floor and your core muscles, you also have to start strengthening these back muscles and these bum muscles as well. What happens to female whose ligament starts to get looser and they're not strong enough to use their muscles to stabilize the joint is, with the Sij, every time you move, they start shearing on each other, they start moving on each other, and it's because of that irritation that you have on joints that you start having a bit of swelling, a little bit of pain right at your back area. Yeah, so most of the time when people have a very acute pain on their back during pregnancy, what we do is, the first thing we do is we take them up so that you don't move that joint. How your body compensates for that weakness, for the instability in that joint, is that if you don't have the muscle strength to stabilize it, you don't have the ligaments to stabilize it, then what happens is to compensate for it, your body will start tensing up. So all your bum muscles and your back muscles, they will start getting tighter and tighter to try to stabilize that joint. It's not something that we want to happen, but it's a natural body response to instability. Instead of letting your muscle get stronger to stabilize the joint, they would just get your muscle tighter to help stabilize the joint. It doesn't work that way. So most of the time when we see mothers who have this sort of issue, the first thing is we have to tape them up, and we also have to start loosening all the tight muscle first. And once we reverse that, then only we can start strengthening. A lot of the time, pregnant women will ask, would they still have the problem after pregnancy? And surprisingly, with SIJ, most often than not, the moment you give birth, you start feeling your back pain. But that does not mean that you don't have that issue anymore, because fundamentally it's weakness that's causing this issue. And if you don't strengthen them, then you're gonna have this issue every time you have pregnancy. Like the first pregnancy, if you have pain and you don't fix it properly, it's more likely than not that your second pregnancy will have this issue, and your third pregnancy will have that issue as well. And also, if you fundamentally already have some weakness on your back muscles, if you don't treat them properly, when you start having baby and when you start lifting them quite regularly, and as the baby get heavier, more likely than not, that's when you will start realizing it, your back pain tends to come back again. So most of the time we tell mothers that we can control their pain, but we need to start strengthening to actually fix the root of the problem. And if they're not fixed, then you will never truly get better. So if you do suffer from back pain and you are pregnant, I highly suggest you seek out some professional help to see which stage of the back pain you're in right now. I hope that through this video you have a better understanding of why you're having your back pain issue. And if you like this video, do subscribe to us. We have weekly updates on health and fitness issue and education. If you like this video, do click the like button. So if you do have any question about pregnancy back pain, feel free to write the question on the comment section down below, and I will try to answer them. If you do have